Is it? Okay. Knock, knock. My name is Alyssa. I'm your student nurse today. I'm going to wash my hands, put on a pair of gloves, and then we're going to get started with your assessment today, okay?
Mm-hmm.
Put on my hands, put on gloves. Okay, if you don't mind, I'm going to sit down. Alright, so can I see your wrist for your identifiers? Name and date of birth, please.
Brock Fire, 32685.
Perfect. So, Brock, what are you doing here today?
Pain.
Where is your pain today?
My neck.
How would you rate your pain on a scale from 1 to 10?
About a 30.
About a 30? That's pretty high. What kind of pain is it? Is it achy, stabbing, tingling?
Stabby.
Stabbing? Is there anything that you're taking for it?
Tylenol, a little ibuprofen.
Alright, how long has this been going on?
About a week.
A week? How did it come about?
Not sure.
Not sure? What's your job?
Maintenance.
Maintenance? Does it hurt when you're at work?
Depends on what I'm doing.
What makes it hurt the most?
Moving it.
Moving it? Is there a certain side that it's on?
Kind of both.
Both sides? Alright, do you do anything else besides take medicine to make it feel better?
Ice.
Some ice? Alright, well, I'm going to be taking a look at it today. Okay, I'm going to be doing an assessment. I'm going to be doing your head, your face, your neck. Okay, we're going to kind of be poking and prodding you, so if you have any pain or feel uncomfortable, you let me know. Alright? So I'm going to get started. Alright. I'm going to take a look at your head. Take a look at the sutures on your head. Okay. Everything feels good on your head. Can you take a look at me? Okay, your eyes are both symmetrical. Your ears, they're both symmetrical and the color looks very good. I'm going to be touching your face now, your maxillary and your face, your facial. Does it hurt at all in there? Okay. I'm also going to be feeling your temporal lobes. Yep, that feels good. Alright, I'm going to be feeling your carotid artery. That feels good as well. Alright, I'm going to be touching your lobes. Okay, your lymph nodes. Alright, auricular, posterior auricular. We got your occipital. We have your superior cervical, your deep cervical, and your posterior cervical. Then we have your mandibular under here, your parotid, your submental. Okay, now I'm going to feel down here. Can you give me a shrug? Okay, those feel good too. Alright, Brock, now I'm going to have you move your neck for me, okay?
Do I have to?
Yeah, can you put your head down?
Not really.
Okay, then can you put it back for me? Alright, I'm also going to have you take a look at me. I'm going to test your cranial 7. Can you smile for me? Okay, now I'm going to have you puff your cheeks out. Okay, pretty even. Alright, I'm going to have you shrug your shoulders again. Okay, I'm going to have you tilt your head into me.
Wow.
That hurts? Okay, I'm gonna have you do it on this side.
I'll eat.
Okay, can you look to the left? Hurts?
It does.
Okay, can you look to the right? Okay, I'm gonna make sure to let the doctor know that. Alright, so I'm also going to just ask you a couple more questions. So, do you drink water?
So,
Some? What is some?
just coffee count.
Nope.
Didn't know.
Okay, so we encourage you to drink 6 cups of water a day.
That's a lot.
It is a lot. But that'll kind of help with the muscles. Yeah, I know. Also, we might refer you to some physical therapy. I'm gonna let the doctor know, maybe we can get you a little something else for pain. But I do want you to do some exercises and kind of keep that head moving. Loosen that up a little bit. But things look good. And I think that when we talk to the doctor, we should also let him know about your job and that it's a very stressful job. And it's a job where you're moving around and moving that neck a lot. Okay?
Alright.
Do you have any questions for me?
No, not really.
Okay. Well, and at this moment, I think that that's pretty much all we can do. Alright. Oh, and then I also need to, before we go, I want to check your trachea. Okay, it's nice and even. I'm also listening for brute sounds, brewy sounds. Never get that word right. Can you take a breath for me? That sounds good. Good. I'm also gonna take a peek at your tonsils under here too. Okay. Those feel good as well. Alright. Well, I think that's it for us today. And if there's no questions, then
You're gonna see a doctor.
yes, the doctor's gonna be coming in. Alright, and then so that's the end of my assessment. I also am gonna go over the cranial nerves. We have 1, which is the olfactory, which is smell. 2 to 6 are the optic nerves. Then we have the 7 is I have this. Just have this. The occipital. Then 7 is the auditory. Then 8 is the glossopharyngeal. Then we have 9, which is the vagus. 10, which is the accessory. 11, which is, can't remember 11, but 12 is the hypopharyngeal. Alright, can't remember the 11, but I know it. So that's the end of my assessment right now, and I hope you have a great one. Thank you very much. Oh.